What is the history behind herbal medicines?
Traditional herbal medicine has existed for so many years in Asian countries. Some rural areas or small villages, there were no Western medicine, only herbal medication. Nowadays, these herbal medicine are still widely used in these Asian countries in parallel with Western medicine. According to World Health Organization, herbal preparation account for up to 50% of total medicinal consumption in China. With the big influx of Asian immigrants to the United States, 7 million Asians in the last 10 to 15 years, herbal medicine has become a big booming market here. Asian languages, radio, and newspaper are flooded with these ads of herbal medicine. However, many of self-proclaimed herbal medicine are actually not true traditional herbal medicine, but in reality mass-produced in factories by some unknown companies, which are then distributed to public through local Asian stores and self-proclaimed herbalists.
A lot of these ads promise cures for chronic hepatitis B. Are these claims true?
Herbalists and manufacturers of these herbal medicine can make any claims they want to. These herbal medicine are not required to go through any study to prove that these medications are truly effective or have any side effects.
But what about the people in the ads who say it worked for them? Isn't that proof? Or what about the doctors you see in the ads?
We can't believe in everything we heard. Once again, these medications are not required to go through rigorous study as required in Western medicine. Many herbalists even use medical terms when they talk about their herbs. However, there's no truth to what they say. I had a patient who I diagnosed a few years ago of having chronic hepatitis B. When the patient came back to see me in 3 months for follow-up, the patient was completely jaundiced. His liver was completely failing, and the patient was required to have emergent liver transplant. And the patient was taking herbal medication. His story was completely different from the story you heard on the radio. And people did not hear these kind of stories on the radio or read on the news.
Why do so many people try herbal medicines if they don't work?
Hepatitis B is a silent disease. And most of these patients who even have liver cirrhosis don't have a symptom until very late stage. So these patients, when they take the herbal medication, they assume that they are cured because they had no symptoms. However, the fact is that these patients, they don't have any symptoms, they don't show any difference before or after taking these medications. So when they think they are cured, but actually they still have the disease, and they will not have the symptom until months or years later. And remember, hepatitis B is a chronic, lifelong condition which requires long-term treatment. These patients taking herbal medication because they want to have a quick fix. They think they can take the herbal medication for a few months as advertised, and the disease is cured.
How is Western medicine any better than herbals? Neither cures hepatitis B.
It is important to understand that this medicine are required to go through rigorous studies. This medication has been studied in hundreds and thousands of patients to show that they are effective and safe to be approved by the FDA for treatment. We now know that these treatments are effective in controlling the virus replications. And by controlling the virus is what helps to reduce the risk of liver cirrhosis and liver cancer. An analogy is high blood pressure. There is no cure for high blood pressure, but the treatment is to help to control the blood pressure to prevent long-term complications of hypertension such as stroke, heart attack, or kidney failures. Western medicine has been shown to have this protective effect, whereas herbal medication had not been able to do so.
But aren't herbal medicines safe too? They're natural, unlike the pills. What's the harm in taking herbs along with the treatments?
It is a misconception that herbal medicine are safe because they are natural. A lot of herbal medicine have a mix of ingredients, and we don't know what's in them. Several years ago, the Department of Health Service in California studied herbal medicine in Chinatown, and they found out that about 10% of these herbal ingredients imported from China were contaminated with heavy metals such as mercury or arsenic, which were quite toxic to human body. There will also have been reported of these herbal medicine could have significant side effects such as liver and kidney failures. If you're taking these herbal medication along with your treatment, there's maybe potential side effects which we don't know, and also the combination of the herbal medication and the treatment can potentiate the toxicity or can reduce the effectiveness of the treatment.
What's your advice to patients who may be taking herbals or thinking about taking herbals for their chronic hepatitis B?
I would steer the patient from hot and cold liver stuff. There is no science to it, and there is no proof that this herbal medication can control the virus. We now have effective treatment to suppress and control the virus, and control the virus is the key to help prevent liver damage, liver cirrhosis, and liver cancer. I will also tell my patient to read the label inserts carefully to know what the mixed ingredients are. Need to know what the medication treating for. Vitamin or purifying liver is completely different from treating the virus and preventing liver damage. Know what the side effects are. Know where the medication are produced. Discuss with your physician about the herbal medication, as this medication can have potential side effects or can interfere with your treatment.
To learn more about proven treatments for chronic hepatitis B, you can visit yourliveryourhealth.com. You can also watch other health casts with experts like Dr. Trinh at this website.